Myself, Dr. Somanathan, Head of Department of Cardiology, EMS Hospital, Perinthalmanna. We started our department in 2004 and our intervention department by 2006. Within this short span of years, we did more than 30,000 angiogram and more than 20,000 angioplasties. Myself did more than 20,000 angiograms and more than 12,000 angioplasties. The angioplasties, it's not only coronary, we did all the peripheral angioplasty, even renal angioplasties. Among the coronaries, we are now doing all the CTOs, that is chronic total occlusion, and even bifurcation lesion, severely calcified lesion, and LMCA lesion. And we used to tackle LMCA with the help of IVAS, and we do all the calcific lesion with the help of rotablation. So with the help of rotablation IVAS, we could tackle all the type B and type C lesions, and even graft vessel occlusion can also be treated like that. And by doing an angioplasty, all these patients can leave the hospital within a short days, that is within 2 to 3 days they can go walking. We are now doing more than 90% of case through the radial approach. By radial approach, they can move around without any discomfort. Previously we were doing through femoral artery, through the thigh, then it was very discomfort for the patient. By doing to radial, they can move around, they can go home the next day itself. And we now started doing peripheral angioplasties. Even the common iliac, femoral artery and infrapopliteal artery angioplasties were done. And unfortunately, if we are using stents in the peripheral arteries, the results were not that much excellent. So we start doing balloon angioplasty with the drug-eluting balloons, which gives a very good result. And in some cases like persistent hypertension, where the culprit is due to a stenosis in the renal artery, we do renal artery angioplasty and we can reduce the number of drugs used for hypertension, and the resistant hypertension can be controlled like that. And we have done more than 10 cases of abdominal aorta aneurysm repair percutaneously. Previously we were doing it by doing a surgery, major surgery, aortofemoral bypass grafting, which needs more than 15 days of hospitalization and a major surgery. And by doing percutaneously the abdominal aorta aneurysm, we can put covered stent through the thigh vessels, and you can introduce through the femoral artery the graft into the aneurysm, and they can leave the hospital on the second day. Only thing that the stents was bit costly, but their hospital stay, morbidities and mortalities very less.